Imagine for a second, right, that you are a patient living in London. You suffer from debilitating chronic migraines, the kind that, completely steal days from your life.
Right, totally isolating.
Exactly. You can't work, you're stuck in a dark room, so you're desperate. You do all this intensive research, you navigate a foreign medical system, and you fly 10 hours to Southern California for a highly effective outpatient surgery.
And it completely changes your life.
It does. But now, imagine you are a patient living in West Hollywood with the exact same condition. For you, this exact same surgical cure is like a 90-minute drive up the Pacific Coast Highway on a Sunday morning, and yet you will likely never even hear about it.
Which is exactly why we are jumping into this specific briefing today. We're doing a deep dive on the Los Angeles chronic migraine crisis and specifically focusing on the work of Dr. Adam Lowenstein.
Right, the board-certified plastic and headache surgeon in Santa Barbara.
Yeah, him. But on a much broader scale, this is really a masterclass in how information silos, algorithms, and cognitive biases can literally hide a cure in plain sight. I mean, even if you have never had a headache in your life, the breakdown of information flow we are going to look at today is a systemic flaw.
It affects how we all receive expert knowledge, honestly.
Exactly. It forces you to question the structural limits of the trusted authorities in your own life.
Okay, so let's unpack this. Because to really understand why a patient in Los Angeles is being left in the dark, we first have to understand what they're actually missing. Like, what are the mechanics of this cure?
Well, we are looking at something called peripheral nerve decompression surgery.
Right, but what is actually happening in the body during that?
So, to understand the surgery, you have to look at the anatomical root cause of a lot of chronic headaches. In a significant number of migraine patients, the peripheral nerves in the head and neck, specifically the occipital nerves at the back of the skull, are being physically squeezed.
Like by surrounding muscle or tissue?
Yeah, exactly. Tissue, muscle, or even blood vessels are just irritating the nerve. So, peripheral nerve decompression is an outpatient procedure done under anesthesia where the surgeon goes in and simply releases that surrounding tissue.
They just physically free the nerve.
Right. They're physically freeing the nerve from being compressed.
It's essentially like finding a tight kink in a garden hose. The water can't flow, pressure builds up wildly behind the kink, and in the human body, that pressure manifests as a blinding migraine.
That is a really highly accurate way to visualize it.
And the surgery isn't rewiring your brain. It is literally just removing the foot that's stepping on the hose so the nerve can function normally.
Exactly. And because it addresses the anatomical root cause rather than just, masking the symptoms with drugs, Dr. Lowenstein's practice sees a 93% significant improvement rate in these surgical patients.
Wow. 93%.
I know. In the context of chronic pain management, that is a staggering statistic.
Which makes the geographic disconnect here completely baffling to me. Let's look at the numbers. The greater Los Angeles metropolitan area has, what, over 13 million people?
Yeah, and based on the epidemiological data in our sources, between 1.5 and 2 million of those people suffer from migraines.
But we need to narrow that down to the specific candidates for this surgery, right?
Right. So roughly 3 to 5% of those sufferers have what are known as refractory chronic migraines. These are the patients who have failed standard medical management.
Meaning they've tried all the preventative medications.
Yep, medications, they have endured rounds of Botox injections, they've gone from doctor to doctor, and they are just still suffering from this debilitating head pain.
So doing the math on that, you have tens of thousands of prime candidates for this surgery living in the greater LA area alone. And Dr. Lowenstein's practice is in Santa Barbara.
Which is just a 90-mile drive from downtown LA.
Right, it's maybe 2 hours on a Tuesday afternoon. And yet the briefing reveals this massive paradox. Dr. Lowenstein actually sees more patients in a given month flying in from Europe, like from the UK, Germany, France, and Scandinavia, than he does from the entire greater Los Angeles metropolitan area.
It is wild.
It's like living right next to a pristine reservoir, but slowly dying of thirst, while people from another continent are chartering jets to come take a drink. How is this procedure so geographically accessible, but the information about it is completely invisible to the locals?
Well, it comes down to a phenomenon the sources call the international patient paradox. It is driven entirely by the psychology of desperation and how that dictates your research depth.
Makes sense.
Yeah, when an international patient exhausts all of the localized options provided by their national health service, they hit a wall of despair. And that desperation forces them to abandon normal search habits.
So they start digging deep into primary medical literature.
Exactly. They cross linguistic barriers, they often translate complex medical journals into a second language, and they completely remove geographic constraints from their searches.
Because they have already accepted that the answer is not going to be found in their own backyard.
Right. They push past the superficial layers of information until they uncover peripheral nerve decompression as a validated surgical option. Then they locate Dr. Lowenstein as a leading expert, and they book a flight.
But a domestic patient in Los Angeles operates differently.
Very differently. Because they live in one of the most medically advanced regions in the world, their search remains shallow. They inherently trust that if a cure existed, their immediate network of local doctors would simply tell them about it.
So they rely on standard referrals and whatever pops up on the first page of a local internet search.
Exactly.
Let's follow that domestic pathway, because this is where the system really starts to break down. If I have a chronic medical issue, my first stop is my primary care physician.
Which is standard practice. But a primary care physician, like a family doctor or an internist, is tasked with managing an enormous breadth of human conditions.
Right, from diabetes to asthma to heart disease.
Yeah, so it is structurally impossible for a general practitioner to maintain specialist-level knowledge of every single emerging surgical subspecialty. Peripheral nerve decompression surgery is just not heavily featured in primary care training curricula.
Okay, so the primary care doctor treats the immediate symptoms, maybe prescribing an acute medication like a triptan, and then refers the patient up the ladder to a neurologist.
Exactly.
But this is where I have to push back a bit. I get authentically perplexed when I hear that the chain of information stops here.
Yeah.
If I am referred to a board-certified neurologist, that doctor is the ultimate authority on treating my head right.
You would think so.
You're telling me they don't know about a surgery with a 93% improvement rate? If they treat chronic migraines, shouldn't they be reading absolutely everything related to their patients? I struggle to believe that this is just some innocent oversight.
I know it is entirely counterintuitive, but this situation is genuinely not born of malice or deliberate ignorance. What is fascinating here is that the neurologists are acting in complete good faith based on their training.
Okay, so what's the structural flaw?
It is that modern medicine has become so ultra-specialized that it creates these massive blind spots. Neurology and surgery operate as entirely separate medical disciplines, which means they exist in entirely separate literature ecosystems.
Oh, wow. It's like two different departments in a massive corporate conglomerate. The accounting department and the marketing department might be working on the exact same project, but they use completely different software systems that literally cannot communicate with each other.
That is the perfect way to frame it.
Yeah.
And the scientific foundation for peripheral nerve decompression surgery is incredibly robust. The peer-reviewed evidence spans over 2 decades.
Right, the sources mentioned a pilot study in 2000 showing a nearly 80% success rate.
Yep, and a larger series in 2005 pushed that to 92%. But most importantly, there was a sham-controlled trial in 2009.
Okay, wait, we need to pause and highlight what a sham-controlled trial actually means, because that is the gold standard of medical research. A sham surgery is essentially a placebo surgery.
Exactly.
They put the patient under anesthesia, they meet the incision, but they do not decompress the nerve.
Right, they do everything except the actual therapeutic mechanism. And in that 2009 trial, the patients who received the actual decompression surgery saw an 83.7% success rate. That definitively isolates the nerve decompression as the cause of the cure, completely ruling out the placebo effect.
That is a mountain of undeniable bulletproof evidence. So where is it published?
It is published primarily in surgical journals, specifically Plastic and Reconstructive Surgery, which is the most widely read journal in that specific field.
And neurologists are obviously not reading plastic surgery journals.
No, they are reading neurology, JAMA neurology, cephalalgia, and headache. A neurologist will rarely, if ever, encounter the surgical studies unless a patient brings it to their attention, or they proactively seek out cross-disciplinary literature.
So when a patient in Los Angeles finally asks their neurologist if there is a surgical option, the neurologist often says no, not because the surgery doesn't work, but because it simply doesn't exist within their professional ecosystem.
Exactly. But the briefing takes this a step further, and this is where the psychology of this crisis gets really dark. Even among the small fraction of LA neurologists who are aware that headache surgery exists, many of them actively dismiss it.
And the reason why is rooted in a profound cognitive bias. Right?
Yes. We are looking at a textbook case of selection bias, and it stems directly from that massive 93% success rate we talked about earlier.
Here's where it gets really interesting. Think about it. If you are a patient who has the surgery and you are part of that 93% who gets cured, what do?
You get your life back.
Exactly. You stop having migraines, which means you stop needing to see a neurologist. You completely disappear from their waiting room. The doctor never sees the success.
Right, but consider the remaining 7 to 10% of patients across these published series who do not respond optimally to the surgery. Their migraines persist. So what do?
They go right back to their neurologist.
Yep. They sit in the exam room and report that they underwent this invasive surgery and it failed to cure their pain.
Oh, it's like a mechanic who becomes convinced that a specific brand of car is the absolute worst vehicle on the road simply because the only ones that ever pull into his garage are broken down.
That's exactly it.
The thousands of cars running perfectly never come to visit. Over a 20-year career, that neurologist might see 3 or 4 patients who had the surgery with suboptimal results and literally 0 patients who reported a miraculous cure.
And that steady trickle of failures systematically distorts the neurologist's clinical intuition. Because the successes are entirely invisible to them, their anecdotal evidence is disproportionately negative.
So they aren't trying to deceive their patients at all.
Not at all. They honestly believe, based on their own skewed observation, that the surgery is ineffective, which leads them to actively counsel future patients against it.
That is wild.
Yeah.
But Dr. Lowenstein actually has a surprisingly low-tech proposed solution to fix this, doesn't he?
He does. He actively instructs his successful patients to schedule follow-up appointments with their referring neurologist.
Just to show them it worked.
Exactly.
Yeah.
He wants them to go back into that exam room simply to demonstrate the good outcome. It is a grassroots effort to correct the data skew, basically making the invisible successes visible again to rebuild trust across the medical silos.
That is so smart. So if the doctors are trapped in their own silos or blinded by this selection bias, it falls on the patient to figure this out. But this raises an important question. Why can't a patient in Los Angeles just pull out their phone and Google it?
Right, we live in the information age.
Exactly. If desperation allows a patient in Germany to find Dr. Lowenstein on Google, why is a patient in Santa Monica hitting a wall online?
Well, if we connect this to the bigger picture, we have to analyze the unique digital environment of Los Angeles itself. LA is arguably the global epicenter of wellness culture, alternative medicine, and health optimization marketing.
Oh, for sure.
So when a domestic patient searches online for chronic migraine relief, they aren't met with peer-reviewed literature. They are immediately bombarded by an algorithmic avalanche of direct consumer medical businesses.
We're talking about a massive, undifferentiated wall of noise. Ketamine infusion clinics, whole-body cryotherapy, chiropractic adjustments, neurofeedback centers, naturopathic detox protocols, essential oil regimens, and medical spas offering off-label injections.
The critical factor here is the marketing apparatus behind those alternative options. A commercial ketamine clinic or a high-end medical spa has a massive advertising budget. They aggressively buy sponsored ad placements on search engines, they run targeted social media campaigns, and they optimize their websites to capture search traffic for terms like chronic migraine cure.
Even though many of these therapies offer little to no peer-reviewed evidence for long-term migraine resolution.
Exactly.
Yeah.
But the algorithm doesn't care about peer-reviewed evidence.
No, it cares about who bought the top ad slot.
Precisely. The legitimate surgical options, which have 20 years of robust sham-controlled data behind them, operate like traditional medical practices. They do not have the multi-million-dollar marketing budgets of the wellness industrial complex.
So they just get buried.
They are algorithmically buried. A patient in Los Angeles doing casual research is mathematically far more likely to click on a sponsored advertisement for a magnetic stimulation device than they are to find the surgical literature. The noise ratio simply drowns out the science.
So, if the algorithm is literally prioritizing a sponsored ad over a scientifically validated cure, how are you as a listener supposed to protect yourself from this? How do you navigate a medical marketplace that is actively obscuring the truth?
It demands an uncomfortable level of critical thinking, frankly. You have to recognize that convenience is often the enemy of truth in healthcare. The overwhelm of the health optimization market actively harms vulnerable patients because it delays their discovery of root cause treatments.
Patients will spend months, sometimes years, and tens of thousands of dollars out of pocket pursuing unproven fringe therapies.
And they are entirely unaware that a high-evidence insurance-coverable option exists just a short drive away.
And there's a specific subset of patients getting lost in this algorithmic noise that we have to talk about, because the structural flaw here is just Devastating. I'm talking about the patients with constant, unremitting headaches.
Yes, this is perhaps the most underserved group within the entire migraine population. These are individuals whose head pain is present 24 hours a day, 7 days a week. There are no discrete attacks.
The pain doesn't begin on a Tuesday and end on a Thursday. It is just a continuous, unbreakable cycle of suffering.
Right, and this is where the actual scientific method works against them. Because of how clinical trials for pharmaceutical drugs are designed, these patients are systematically excluded from the research.
Wait, really? Why?
To understand why, you have to look at the mechanics of a pharmaceutical drug trial. To get FDA approval, a drug company needs clean, measurable data. They need a patient to say, I usually have 10 discrete migraine attacks a month, but on this new medication, I only have 2.
So you need to be able to count the episodes before and after.
Exactly. If a patient has one continuous, never-ending headache, the math breaks. You cannot measure a reduction in frequency if the frequency is singular and constant. Therefore, they do not meet the inclusion criteria for the trials.
Which means they are essentially erased from the pharmaceutical evidence base.
Correct.
So when a neurologist is sitting across from a patient with daily unremitting pain, and they check the established drug literature to see what to prescribe, they just find a blank page.
And tragically, they often relay this to the patient as, your condition is untreatable. They are told there is no hope, not because their body can't be healed, but because their pain profile doesn't fit neatly onto a pharmaceutical spreadsheet.
But the reality is entirely different. Research published in 2019 in the Journal of Headache and Pain established that constant, unremitting head and neck pain frequently originates from precisely what we discussed earlier.
Right, peripheral nerve compression, particularly of the occipital nerves.
Because surgery doesn't care about your pharmaceutical spreadsheet. A surgeon doesn't need to count your discrete headache attacks to know if the surgery worked. They just decompress the nerve, and the continuous pain stops.
Exactly. For these patients, peripheral nerve decompression isn't just an option, it is frequently the only evidence-based option available to them. And yet, buried beneath the journal silos and the algorithmic noise, most of them will never find out.
Which forces us to look at the stark geographic reality of this entire crisis. For such a densely populated, medically advanced region, the competitive landscape for this specific procedure is remarkably barren.
It really is. Dr. Lowenstein's Migraine Surgery Specialty Center in Santa Barbara is the most prolific headache surgery practice in Southern California.
In fact, according to the sources, there are no other highly experienced headache surgery centers in Los Angeles. None in Orange County, none in San Diego, the Inland Empire, or the Coachella Valley.
The nearest alternative center with meaningful high-volume headache surgery experience on the West Coast is located in the San Francisco Bay Area, which is roughly 350 miles away.
And if you look beyond California, a patient is looking at flying to Madison, Wisconsin, or Dallas, Texas. So what does this all mean? It means that for millions of people suffering in Southern California, the answer to their debilitating pain doesn't require a cross-country flight. It doesn't require navigating a foreign medical system or spending their life savings on unproven wellness fads. It is literally just a drive up the 101 freeway to Santa Barbara.
And we cannot lose sight of the profound human cost behind all of these statistics and geographic data points. We are talking about real people whose lives are being systematically diminished by a condition that is, in a vast number of cases, surgically addressable.
People who are missing work, losing income, and enduring severe side effects from heavy-duty medications.
Parents who are withdrawing from their families because the unpredictability of the pain makes participating in normal life impossible. The true tragedy here isn't just the pathology of the illness. It is the artificial barriers keeping suffering people away from an accessible cure.
For patients actively navigating this, the briefing notes that more information can be found at headachesurgery.com or by calling the Migraine Surgery Specialty Center directly at 805-969-9004. Dr. Lowenstein has also authored a patient-facing book titled Headache Surgery: Understanding a Path Forward,
which was specifically designed to bridge this exact information gap and bypass the medical silos entirely. Because it is abundantly clear that the traditional channels of medical information dissemination are structurally failing these patients.
Let's pull all of this together. We started with a geographic paradox, right? A world-class surgical center with a 93% success rate sitting 90 miles away from one of the largest populations of migraine sufferers on the planet, yet drawing more patients from London than from Los Angeles.
We explored how primary care doctors are simply overloaded as generalists. We uncovered how ultra-specialization traps neurologists and surgeons in completely separate literature ecosystems.
Meaning the doctors treating the heads never see the surgical advancements curing them.
Exactly. We dissected the insidious invisible success trap, that massive selection bias where neurologists only see the surgical failures because the cured patients disappear, completely skewing a doctor's perception of reality.
And we looked at how algorithmic noise from aggressive, well-funded wellness marketing buries legitimate, peer-reviewed science under a mountain of sponsored ads. Finally, we saw how patients with constant, unremitting headaches are structurally erased from the very drug trials meant to help them, leaving surgery as their best, yet often deeply hidden hope.
Yep.
Whether you suffer from chronic pain or not, this deep dive proves something essential about living in the modern world. Being truly well-informed requires relentless curiosity. It requires looking past the first page of search results and questioning the structural limits of expert advice. Just because an authority figure doesn't know about a solution does not mean that solution doesn't exist.
That's such a crucial takeaway. We talked today about the invisible success bias, how neurologists only see the surgical failures because the cured patients disappear from their waiting rooms. It makes you wonder what other areas of our lives, our institutions, or even our personal relationships are being entirely shaped by the squeaky wheels of failure, simply because the silent, staggering successes never think to report back.